This video will explain how to replace the feeding connector or wire adapter on a Corflo PEG tube and explain how to advance and rotate this type of PEG tube. You will need to replace the feeding connector on a PEG tube if it has broken off, has split or is leaking. You will need a replacement Corflo wire adapter of the appropriate size. The sizes are 12 French or 16 French. The size of the tube should be shown on the tube itself. Check that the new wire adapter is within its expiry date. Before replacing the Corflo wire adapter, wash your hands for 20 seconds. You should also wear gloves and apron if you're in a clinical setting. If you are changing the Corflo wire adapter for someone else, you will need to explain the procedure and gain consent from the patient or perform the procedure in the patient's best interests. Ensure the clamp on the Corflo PEG is closed and close the wire adapter caps. Open the new Corflo wire adapter and untwist the skirt from the wire adapter. Untwist the skirt from the old wire adapter and move down the tube. Gently remove the wire adapter from the PEG tube by pulling gently. Then remove the skirt from the PEG tube. If the tube is stretched at the end of the PEG tube, cut approximately 0.5 centimetre off the tube with clean scissors. Put the PEG tube through the narrow end of the new skirt. Push the hard part of the wire adapter into the PEG tube until the tube stops. Twist the skirt onto the wire adapter until the stop is reached. Dispose of the old wire adapter and gloves and apron, if used, and then wash your hands for 20 seconds. This video will also explain how to advance and rotate a Corflo feeding tube. Once the PEG tube has been in place for 2 weeks, it must be advanced and rotated at least weekly and no more than daily in order to prevent the bumper inside the stomach from becoming stuck and buried in the stomach lining. Firstly, wash your hands for 20 seconds, wear gloves and apron if in a clinical setting, and get consent from the patient. To advance a Corflo PEG with a Tbar external fixator, you will need to move the Tbar away from the skin by approximately 2 inches or 4 centimetres, an average thumb length. Do this by first moving the cuff and then the Tbar. If the tube or stoma site requires cleaning at this point, do so using gauze and water. Advance the tube into the stomach by 2 inches or 4 centimetres, then rotate the tube 360 degrees. Pull back gently on the tube until you feel resistance from the internal bumper. Move the Tbar and cuff back to the correct position, which is approximately 2 millimetres from the skin. Note that the Tbar shouldn't be too tight or too loose. To advance a Corflo PEG tube with an external fixator called a right-angled adapter, you will need to open the white plastic fixation device by holding both ends and twisting them away from each other until the two parts separate. You will then proceed to advance and rotate the tube in the same way as just shown. If you need to replace a clamp on the Corflo PEG, you will also need to follow the instructions just given, as the Corflo wire adapter will also need to be replaced at the same time. Please note that you will need to pinch the tube when replacing the clamp to avoid leakage of gastric liquid. Call the Gloucestershire Home Enteral Feed team, your GP surgery or community children's nursing team to request additional spare Corflo wire adapters, PEG clamps, or if you have any difficulties. Thank you.